Hello, I'm Dr. Mark Rohde, and I'm a psychologist who's a recovery specialist. Today I'd like to focus on early recovery, specifically for those with eating disorders. At True Aftercare, we recognize that the toughest day of recovery is often the day you leave inpatient or residential care. Finishing up at an intensive outpatient program can also be rough, and you may have anxiety about that transition. I'd like to try to explore some of what seems to work best for many people with eating disorders. Now keep in mind that no podcast can take into account all of the different approaches to care. If I say anything that's in contrast to what you've heard from your doctor or therapist, go with what they say, or use my comments simply as a point of discussion with them. Few, if any, recovery specialists would ever suggest doing this alone, and having the support of a team is often an incredibly good idea. Hopefully your discharge plan includes a therapist who's an eating disorders specialist. Hopefully, too, you'll be attending either a support group or a therapy group. Many patients benefit from working with a physician, a psychiatrist, perhaps a dietitian or a nutritionist, and maybe a personal trainer or an exercise physiologist. Your team should be based upon your unique needs. If you don't think you've got the right team, be sure to speak up. You may know by now that it's rare to have an eating disorder without other emotional challenges, so it's critical that you also address the depression, anxiety, relationship difficulties, or other challenges in your life. The reality is that recovery from an eating disorder can be difficult, but recovery from an eating disorder will be a whole lot easier when you address the other challenges in a comprehensive manner. There are several approaches to psychotherapeutic treatment that the research points to as being especially useful. If you don't know them by name, they are cognitive behavior therapy, dialectical behavior therapy, and family therapy. Your doctor or therapist may also suggest a range of approaches that may include everything from aromatherapy to equine-assisted therapy. Don't be hesitant to ask about the potential benefits of the type of care you're receiving. You probably also know, and hopefully have come to a point of acceptance of the things that you simply can and cannot change. You can't control, change, or modify your genetic makeup. That's just the way it is. And that's probably just fine. We hope that you're moving toward a peaceful and warm acceptance of yourself. Participation in an eating disorder support group is typically an essential part of the recovery process. While I have deep respect for those who want to solve their own problems in their own way, this just doesn't typically work very well for most people with eating disorders. Many communities have a variety of support groups for different types of eating disorders. You may wish to try several different groups to find the best fit for you. There's a popular saying that you've probably heard, "You are what you eat." I'd suggest you focus more on "you are what you think." I like this one better because thinking drives feelings, and it is thinking that ultimately drives behavior. Sometimes the thoughts that we have about ourselves are not kind, and we would urge you to work toward adopting an internal dialogue that is both positive and self-nurturing. Please keep in mind that your worth cannot be measured in pounds, inches, ratios, or proportions, and that physical measurements are minimally important in comparison with personal values. Now let's consider what's important: acceptance, connection, autonomy, creativity, faith, fun, growth, meaning, self-respect, maybe wisdom. Listen to your values. When your values are in line with the way you live, life is pretty good. The truth is that eating disorders can be rough on the body, and it will be important that you consume the right foods to ensure that you've got the nutritional building blocks for both your mind and your body. Eating is a lot more than calories and carbohydrates. It's about nutrients. Please work with your physician or your nutritionist so you eat the right foods to repair whatever harm may have happened while your eating disorder was most active. We hope and anticipate that you're working with a physician who is active in monitoring your recovery. Eating disorders are potentially lethal, and we advise regular medical attention throughout the recovery process. You've probably heard about listening to your body. You're likely to know the difference between true hunger and boredom, sadness, stress, or emptiness. When you eat, be mindful. Take it slowly. Enjoy the taste. Savor the aroma. Be aware of the texture of your meal. And remember that there's often a lag between the time that the food hits your stomach and your brain knows it's full. If you have any questions, go to Google and look up mindful eating. You may want to inquire to ensure that the treatment you've been receiving respects your cultural differences and the eating norms that are associated with your background. Frankly, there are stark differences between the food-oriented expectations in a California beach community, Southern hospitality, and a Greek-American community. Cultural norms can and do play a role in how we relate to food. Don't be shy about talking about this with your therapist. If you and your therapist have not yet developed a relapse prevention plan, now would be a great time to do it. If you're not working with a therapist, your recovery coach can probably help, but we'd strongly encourage you to see a psychologist or a therapist. Lastly, if you're a person of faith, know that you've got a built-in support network at your church, temple, or mosque. We hope that you're not shy about reaching out for the support that is so readily available. Today you've got a lot of the basics. Never hesitate to talk with your therapist or your recovery coach about any issues that might arise. Thanks for listening.